Hey, hi, welcome. My name is Storma. I'm a herbalist, and today we're talking about sickle cell and discrimination. Oh, sucks. Especially in the hospital. Boo, discrimination. I mean, who likes that? It's important that we have this conversation because it happens a lot. If you're a person of color, going into the hospital, especially if you know your stuff and you're super smart, you already know what your treatments are. If you start talking about like, yeah, I need, X amount of, hydromorphone or morphine or whatever the drugs are, fentanyl. These are drugs that they give us for sickle cell for the pain. But if you go in there and talk about, yeah, blah, 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 they think of you, or they look at you, and they may treat you like you're a drug seeker. They always use that term. Oh, she's a drug seeker, blah, blah, blah. I was 7 years old. 7. I was a little kid and they thought I was a drug seeker. Huh? Really? That's so weird. Yeah, so no, 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 no. Discrimination is one of the biggest issues. So when I go into the hospital, I always have my documentation on me. It has my name, it has my doctors, it has my treatment plan, and it has the diagnosis. Really important. That adds validity to your case. I also like to go with someone, witness, because sometimes, some doctors and nurses, not all of them are created equal, right? We love our doctors and nurses, they are good people, but some of them are tired, they're not in the mood, or there's racial profiling happening unconsciously. Maybe they don't mean to, whatever, but it happens a lot, too many times. And unfortunately, with sickle cell, it can be lethal, right? If they send you home without medication, it can be lethal. People have died. So it's actually it's a big topic. And if you're dealing with that kind of thing, it's good to have an advocate. It's good to send in a formal complaint. If this has happened, some of the doctors and nurses are getting racial sensitivity training and all that, but it still happens, and we kind of have to be careful about all that. And what I usually do is having that documentation really helps. I call ahead to your doctor or your hematologist, particularly your hematologist, before you go, because if you go, maybe they'll come downstairs or to the emergency room and help out. No, 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 this patient, I know this patient, this is a good person, she's reliable, she's valid, right? She's, whatever, and we'll let you into the hospital. But yeah, please share some of your experiences and comments or whatever in the link in the thing below, because it's a big topic. And if you have any strategies, what are your strategies for avoiding discrimination or dealing with discrimination when it occurs in the hospital or in the medical setting? We all need to sort of share in that idea. On the Sickle Cell Association page, we have I have a little area called Sickle Cell. It's a Sickle Cell lecture or lecture library. And in there's someone who spoke really well. Oh, geez, I'll put it in the link below. He was amazing, and they talked about discrimination and sort of how to get around and how to deal with that, because it's a big issue. I sort of wanted to give you some of the little tiny strategies that I use. Having a witness, having people around, not being there alone in the hospital, having an advocate, talking to an advocate, sending in a complaint, having your documentation. All of that is really important. It can help a little. Maybe it does, maybe it doesn't, but it's better than nothing, right? It's something. And instead of going, well, I need this and I need that in medication, just saying, well, this is what they've used before. I don't know if that's, something that you want to use, but, whatever. That way they're not thinking, oh, she's just ordering us around and telling us what to do and she just wants your drugs. It's horrible. So just approaching it in a different way, just saying, these are the treatments that they usually give. Here's my treatment plan. There you go. Read, and maybe that will help. I don't know. It's helped for me, and it might help for you. But, again, this is a big issue, and, not all doctors are equal. Some are like amazing, and some are not so great. So yeah, we have to kind of like gauge that. Take care. Bye.